Hey there, I'm Krystal Allan with Channel 3, getting ready to interview healthcare partners. Can't wait. It's going to be great.
This is News 3 at Sunrise with Krystal Allan.
All right, special guests in studio just in time for Father's Day. In the end of Men's Health Week, we have Dr. Chard Bubb joining us today, an endocrinologist, to tell us about something that honestly I'd never really heard of, Andropause. So for those of our viewers who, like me, really didn't know much about this, tell us a little bit about what this is all about.
Well, andropause has to do with decline in testosterone levels as men age. And as they age, they tend to have manifestations in terms of symptoms. Some of the common complaints, which could be non-specific, include night sweats, irritability. There will be a decrease in lean muscle mass, increase in fat tissue, and also decline in sexual function.
Very interesting. So I guess it's somewhat comparable to menopause, then, if I'm not making a wrong assumption.
Sort of, yes.
Okay, so what do men need to do to just kind of I guess doing the yearly checkups or things like that, or some of the things they need to be doing just to make sure they're getting what they need to kind of, I guess, address this issue, andropause?
Well, yeah, the importance is having an open conversation with your provider. The history is very important in some of determining that this could be a factor, because it could be non-specific, and based on the history, your doctors can go ahead and do testing by checking some of your hormone levels. Upon doing those levels, then it could be a lot more clearer that this could be the underlying cause why this man is having these complaints. Yeah,
really interesting. I mean, and I guess when they're going through this, they probably don't recognize it for what it is.
Yes.
Yeah, so I guess it's really important for people to be able to recognize these signs and see it, for what it is.
Yes.
As they kind of, come up against something that probably they don't know what's going on with their bodies here. So you say important to get those yearly checkups, to stay in communication with your providers, so you have an idea of what's going on with your body as you transition into this phase of your life. Very good. Well, any other information that would be helpful for our viewing audience to know in terms of andropause here?
Well, I think as time has gone along, patients have become more comfortable talking to their providers, because one of the primary concerns have been a decline in erectile function, and I think that it's important to talk to your doctors about this because the repercussions are pretty much widespread in terms of the family structure with this issue. So once your doctor is sensitized to that issue, I think you could get help that you probably would not think available.
Gotcha. Very good. Well, we want to thank Dr. Chard Bubb for coming in studio to share with us about this information about andropause, and very interesting information, in fact, I really didn't know about. So we're enlightening our viewers with information that they can use.